Fiji, just let us know when you've started.
Yep, already started.
Okay. Kia ora from New Zealand. I'm Dr. Karaponi, Okesene-Gafa. I'm one of the obstetricians gynecologists based here in New Zealand. I'd like to extend a warm welcome to you all. Nisambula to our colleagues in Fiji who will be mostly running our webinar this evening. Whakalawhalahi atu tālofa lava Māori, whakatalofa atu aloha. Kia ora malole, and really warm Pacific greetings to you all. I'd like to take this opportunity to thank our group in Fiji, Dr. Amanda Noovao Hill and your group. We've got Dr. Fatiaki and Dr. Vasitia who is joining us tonight, and I will hand over to Dr. Amanda Noovao Hill for she will be going through our series tonight. So she will choose one of her team to do with the opening prayer. She will also introduce the team, the panelists, and then she will go through her slideshow. There'll be any questions that they're going to be able to answer at the end of it. Please put your questions either on the chat or on the questions and Q&A button that's available at the bottom of your screen. And then I'll give you a brief update from 3 other Pacific nations, and then we will also close with a word of prayer. So without further ado, just welcome all of you. I will now hand over to Dr. Amanda Noovao Hill and for the beginning of our webinar. Great to see you all, everybody.
Naka Wakalevu for the welcome, Dr. Kara. Greetings, everybody. I would like to introduce the Fiji team. So we have a small team that are representing the group. We have Dr. Byron Fatiaki, who is a junior consultant, and he works in the Lautoka hospital. He's actually in quarantine at the moment after working a little bit too much. Dr. Vasitia Vati is our head of department at the Lautoka ONG unit, and she's a lovely lady, a scary boss, but she's a lovely lady, and she is one of the COVID management team leaders in the Western Division, and I'm delighted that she's been able to take time out of her busy schedule to join us as a panelist. So these 2 colleagues of mine have all the details with regards to the experiences of our team, and they can share those experiences if anyone wants to hear the details. But I will present a few slides on behalf of our team. So,
hi, Dr. Amanda. Dr. Pio from your group has also joined in.
Awesome. So Dr. Nina Pio, I don't see her on my screen, but she's probably zooming in from theatre because she's on call, and I'm so glad she's also been able to join us. Dr. Pio is a junior consultant along with our team. We have a pretty awesome team in Lautoka. So one's in quarantine, one's at work, and Dr. Vasitia is looking after all of us from somewhere in Nandi. So welcome everybody and greetings. Bulabinaka, Kia ora, fellow Pacificans. I have a question to ask you all. Can you remember what you were doing this time last year? June 10th, 2020. I was doing this exact same thing. But the topic of the session last year was anticipating COVID-19, the Fiji experience, waiting for the first wave. It was a RANSCOG webinar, but it was held on June 10th. It was a Wednesday. Some of you were there too, I think. So it got me thinking, I wonder what next year's story is going to be about, God willing. This is my outline of the presentation this evening. And this presentation is made on behalf of the ONG teams from Lautoka, Lambasa, and Suva. The stories in this presentation are their experience, and therefore this is their story. This is a slide from last year's talk. There are 3 divisional hospitals in Fiji, and they look after 4 health divisions. We have, let me get my laser pointer, the Central Division, the Eastern Division, the Western Division, and the Northern Division. A CWM in Suva, which is here, looks after the Central and the Eastern Divisions, and combined, these two areas have a population of about 423,465 people. Within these two divisions, there are 100 health facilities ranging from nursing stations to subdivisional level hospitals. The Lautoka Hospital, which is where the four of us are based, is a tertiary hospital for the Western Division. And although it does provide primary and secondary health care to some extent. From the 2017 national census, the Lautoka Hospital serves a population of about 337,000 people. And this is about 38% of Fiji's population, spread over 2/3 of the country, as well as the maritime areas of the Yasawa Islands, Mamanuthas, and Vatulele. There are 6 subdivisional medical districts in the Western Division, with Rakiraki in the northeast, Tavua, Ba, Lautoka Yasawa area, Nandi, and then the Nandrunga Navasa area down south in this area here. So the Lautoka Hospital was established in 1974, and it was, at the time, it had about 340 beds and it could manage 2,500 deliveries per annum. We currently manage more than 4,000 deliveries, and we have just over 300 beds in the hospital. The Northern Division provides health services for a population of about 135,000, and this is spread out over 4 subdivisions of Bua, Bakondrove, Maduata, and Tabiuni. And health services are delivered from 1 divisional hospital, which is here in Lambasa, 3 subdivisional hospitals, 20 health centers, and 21 nursing stations. As of today, there are no COVID cases in Lambasa or the Eastern Division. COVID-19 was first diagnosed in Fiji on March 19th, 2020. And from March till December 31st, Fiji had recorded 49 cases and 2 deaths, both occurring in August. There were no cases recorded in the ONG units in 2020, but we had a few scares and valuable experiences and lessons were learned in navigating that first wave. On March 6th this year, Fiji became the first country in the Pacific to receive the vaccine under the COVAX initiative. The first batch of 12,000 life-saving AstraZeneca vaccine doses were delivered to Fiji by the COVAX facility in an unprecedented effort to provide at least 2 billion doses of COVID-19 vaccines globally by the end of 2021. Fiji has since received more batches of the AstraZeneca vaccine, and on May 24th, 2021, we rolled out the second dose program. The groups that were prioritized to be vaccinated first were frontline workers at airports, seaports, hospitals, and healthcare facilities, the hoteliers in quarantine facilities, and the disciplined forces. Persons with existing medical conditions and family members of frontline workers were also prioritized, as too were the elderly, the people over 60, and all individuals 18 years and older. And as of June 8th, 136,247 first doses had been administered. This was 15% of the population, and 2,913 had received a second dose and deemed fully vaccinated. On April 19th, the B.1.617 Indian variant reached our shores, and through a super spreader event attended by approximately 500 people, spread through the Western Division of Fiji. The Western Division of Fiji immediately went into lockdown and schools closed. The Western Health subdivisions of Rakiraki, Tavua, Ba, Nandi, and Singatoka were unable to access their tertiary hospital because of the lockdown imposed. And as a result, like happened in 2020, the CWM hospital deployed teams to these sites to provide ongoing healthcare service. Lautoka Hospital continued to operate and provide service within the city. On May 5th, Fiji recorded our third death due to COVID-19, and this occurred in Lautoka Hospital. 2 hospital staff tested positive and were linked to the case that died. Entire shifts of medical, nursing staff, and ancillary hospital staff who had either worked with the 2 doctors or were with the COVID patient were placed in quarantine facilities. Within a matter of hours, those who were on site in the Lautoka Hospital were advised that they would not be allowed to leave, as it was deemed that all on site were at potential risk of exposure. That meant patients, their visitors, and the staff were not permitted to leave for the next 21 days, and the hospital compound was placed under guard by the discipline forces. Fiji's COVID count before the second wave, so before the 19th of April, was 74 cases. By the 8th of June, our count had exceeded 700. And 24 hours ago, Fiji recorded 888 cases with 4 deaths. With the main hospital now in lockdown and not accessible to the city of Lautoka, we needed a drastic plan. Decentralizing and remodeling ONG services is not a foreign concept to our unit. Under the leadership of Dr. Jimmy Tairia, Dr. Vasati Avati, Dr. Kalera Bavandra, who is the ONG Clinical Service Network Chairwoman, and the senior ONGs, the ONG unit have been discussing how to conduct the decentralizing activity, and it currently takes the form of outreach clinics. So all 3 divisional hospitals in Fiji have been, to a lesser degree, doing similar activities and supporting the sub-divisional health hospital teams. In the recent years, as the tertiary hospital staffing has slowly increased due to the increase in number of graduates, this has enabled the registrars and junior consultants to form their own clinical teams and then adopt and mentor each of the subdivisional hospitals in their division. So in our division, we've got the 5 subdivisional hospitals. This mentorship has been in the form of weekly for NANDI or monthly for the remainder outreach visits. And during these outreach visits, the team conduct antenatal clinics, gynae clinics, minor procedures like tubal ligations, as well as deliver continuous professional development sessions. Recent discussions of decentralization came up again with the NSOAP, or National Surgical Obstetrics Anaesthesia Planning Initiatives, led by the Harvard Medical School, the United Nations Institute for Training and Research, and the Royal Australasian College for Surgeons. And in this 3-day NSOAP meeting, it was recognized that for these services to be successful in ensuring universal health care accessible to all Fijians, the service delivery at the subdivisional hospitals needed to have on board not just ONG, surgery, and anesthesia, but we also needed to have on board all the other units and the services such as pediatricians, the physicians, the laboratories, radiology, ultrasound scan. We needed the nurses, the midwives, the consumables, and so forth. So the conversations about decentralizing service have been ongoing, but COVID forced our hand and we had to decentralize quick smart. When the second wave hit in April, just turn that pointer off, the ONG unit arranged themselves into 3 teams, equally dividing consultants, senior and junior registrars, interns or house officers. And each team was rostered to cover different on-site and off-site work to ensure that service delivery continued, that the team bubbles did not mix with each other, and that those who were not on the clinical floor were continuing to work on unit protocols and get some rest. Team leaders and team members were identified, and workload and responsibilities were allocated. When Lautoka Hospital was locked down, 2 consultants, one of which is on the panel, 1 senior registrar, and 2 interns were on site. One of the ONG consultants was a member of the COVID management team, and so her priority work was with that group. The teams were rearranged and then were asked to move out and set up health centers and convert them into functioning maternity units for immediate use. The time frame from lockdown of the main hospital in the West to deployment of teams to health centers was about 2 hours. Doctors and nurses living in areas outside of the Lautoka area, like Rakiraki, Tavuoba, Nandi, and Singatoka, were asked to report to the hospitals in the area, and they joined the resident team to provide ongoing ONG service. So tertiary obstetric and gynecology services, usually offered in Lautoka, now had to urgently decentralize to these sites listed. From the moment the call was made from Dr. Vasatia, our HOD, leaders within the unit stepped forward, leaving the safety of their homes, their spouses, their young children, their parents, their family members, leaving them behind with only a couple of hours' notice. The plan was that the teams would rotate after 1 week, but no one really knew what to expect. So lockdown happened at 4 p.m. and dinners in most households that evening would have been fraught with anxiety as the doctors and nurses tried to organize themselves, their families, and then their new living and working facilities, which needed to be fully functioning immediately. The first few days called for huge amounts of courage and patience and communication. The decisions and allocations of responsibilities and work sites, as well as the movement to those sites, occurred over a matter of hours. And a whole lot of initiative and innovation was needed to keep the spirits up and to keep the team going. In these tough times, leaders were molded and emerged to hold the team together. University regulations prevented me from working on the clinical floor, but my continued inclusion with the team allowed me a valuable perspective. It was heartbreaking to hear the story of the scary clinical moments, to marvel in amazement at the skills and the lucky saves, and to hear of the physical as well as psychological discomfort. These have been extremely extraordinary circumstances, and the ONG team have persevered. The least I could do was to bring the team together for handover morning meetings at 7:30. And we continue to do this activity daily, sharing 2 mornings a week for Journal Club, where final year medical students are invited to listen. So VCSA Sai Health Centre is located midway between Nandi International Airport and Lautoka, was set up through a trust fund and is a purpose-built health facility that provides free healthcare. It usually provides medical and nursing care for MCH clinics, general outpatients, and some special outpatients for diabetes and hypertension. And these normally offer clinics from Mondays to Fridays, 8 a.m. to 4:30 p.m. On May 5th, the team moved into the VCSA Sai Health Centre to rearrange the furniture. Within hours, it needed to be converted into a 24-hour unit, catering for low-risk obstetric deliveries. The waiting room and the corridors were converted into labor and postnatal wards. The conference room, the clerical room, and the clinical consult rooms were converted into an assessment room, a first aid room, and a delivery room. This team delivered twins. They had a shoulder dystocia with a baby with a birth weight of 5.5 kilos. They managed cord prolapses. They provided care to women who birthed prior to arrival. And these were just a few of those experiences. They stabilized a pediatric asthmatic and an acute myocardial infarction, and then referred them to the FEMAT physician tent. There was no pediatrician on site in the VCSA Sai Health Centre. There was no blood bank or lab facilities, and there were no operating facilities. The Fiji Emergency Medical Assistance Team, or FEMAT, was activated and set up in Lautoka to cater for hospital admissions. So this was an emergency hospital tent, and was a hospital setup, and they were able to provide emergency surgery and high-risk deliveries. They were limited too by the non-availability of a pediatrician, and the staff that manned the FEMAT unit were colleagues, medical and nursing colleagues from Lambasa Hospital in the north and CWM in the central division. We have a hospital boat, and so the MV Veivueti is the medical carrier, and this was deployed and docked at the Lautoka wharf, and they provided operative ONG. And the first cesarean section performed on this boat happened to be on Mother's Day weekend, and this was a case that was referred from the VCSA Health Centre. MSP, or Medical Services Pacific, is a Fijian-based charity that provides a range of developmental services for vulnerable communities, including providing women with reproductive health care. And the service was converted to assist with providing antenatal clinics when the VCSA Health Centre closed down recently. So the MSP offices were actually a lot more convenient because they were accessible, being in the middle of the Lautoka city. So there were several challenging moments. I actually received several pages of challenging moments when I asked for some thoughts to include, and some of these can be summarized as limited or no on-site access to operating theatre services, other disciplines like anesthesia and pediatrics, no access to allied health services like the lab, blood bank, pharmacy, medical imaging. Hospital support services like laundry and sterilization and waste disposal were also limited or not accessible to some of the settings that, some of the centers that had to be set up. There was a challenge with accessing sufficient consumables such as PPE. One of the subdivisional hospitals recently obtained a gene expert machine, and so this was invaluable in that it helped to process the nasopharyngeal swabs a lot faster. And then that meant that our laboring women we were able to determine their COVID status a lot faster because there was a gene expert machine on site. But it was a constant need to be 100% on top of your game. You had to be aware, they had to be able to anticipate which cases could stay in the facility safely, knowing that you didn't have blood, you didn't have an operating theatre, and you didn't have a pediatrician in your building. Teams often had one consultant and or a senior registrar who were on call for 24 hours a day, 7 days a week, or for the duration of deployment. So physical, psychological, and emotional fatigue were common, but patients needed the team to be sound, to be proficient, and to be compassionate clinicians because they were scared too. This slide, I think, covers lots of descriptions of the low moments. In addition, homesickness was something that a lot of the team mentioned. 2 of our new mums missed their first Mother's Day with their bubs. Birthdays were missed, anniversaries were missed. Being on call constantly was a low. There were issues with accommodation and there were issues with food. Some highs. The ONG unit's model of team bubbles, working geographically apart but in constant communication with each other, has meant that unlike our colleagues in the other disciplines who lost large numbers of their workforce to quarantine facilities, we were pretty functional. So ONG, from the Permanent Secretary of Health to the intern house officer and our midwifery and nursing teams, have contributed significantly, enabling us to providing service closer to a patient's home. There is no simulation activity quite like a national emergency to force us to learn to work as a team. So team bonding and teamwork happened. Young leaders emerged. There was time for self-reflection for those that got stuck in the quarantine facilities. We improved on our communication skills, and we have witnessed and are grateful for the community support that's been shown. One such example was on the second day of deployment to the VCSA Health Centre, the need for appropriate accommodation for 23 staff was recognised. So there was just no space for 23 staff to be housed. There was limited clinical working space to cater for the load. And so the VCSA Health Clinic Trust purchased a customised container to provide more space. And this was an example of a public-private partnership and ability to mobilize urgent resources. Other examples were donations of food and toiletries to the newly set up health centres, to the patients and staff by local business communities. Other highs are we've become really Zoom savvy, and we've managed to continue with Team CME weekly journal clubs. So COVID has made us rethink about hand hygiene, masks, and social distancing as primary healthcare measures in an environment where these are neglected practices. COVID lockdown measures suggest that we need to decentralize obstetric care, particularly the low-risk cases. We should think about re-establishing emergency operative capability and capacity at the subdivisional hospital level. The seasonal hurricanes and floods will create annual challenges, and so these services will be required. Subdivisional hospitals need expert generalists as lead clinicians, rather than junior medical officers. Zoom handover rounds and case discussions are a way forward for supporting decentralization of clinical services to the subdivisional hospitals. So we, as a unit, have been able to demonstrate this usefulness and this ability to support our team that are out in the subdivisions. So we are trying to keep our heads above water in this second wave of COVID-19. While the vaccination programs continue to roll out and testing is ongoing, we must continue to provide safe, timely, and effective reproductive health care to the women of our nation. Thank you for listening. That's our story, and we are happy to take questions and comments.
Thank you very much, Amanda. That's incredible. That's amazing. The work that you guys have done over a very short period of time. I mean, that's actually quite phenomenal. Yeah. Just to the audience, there is a chat if you'd like to put your, or you can put your questions on the Q&A button. But I'd be, I mean, oh man, that's just incredible. How could you do that in the time when there was so quickly in 2 hours, you know, decentralizing your services, getting your teams together. And that's just amazing, Amanda. I mean, be really interesting to hear from your group, you know.
I think I'd invite Dr. Fatiaki and Dr. Pio, because they were probably the first lot to head out that day, that afternoon, and they had to leave their families behind. So they'd be the best people to describe what that felt like.
Over to you, Dr. Fatiaki, if you want to unmute.
Thank you, Amanda. Thank you, Dr. Karaponi. Hello, everyone. Having to, I guess, everything happened so fast, and overnight we were made aware at the same time, I guess, as the public was made aware of the maternity services being relocated to VCSA Health Center. So we had a quick Zoom session with the consultants and the registrars and quickly designated ourselves into bubbles. And I guess there's nothing that you can do to prepare for something like that. Really, everyone's willingness and the ability to, I guess, put your hand up at that moment when we had to go that evening was, I guess, admiring on everyone's part. And from the whole, I guess, from the experience, we became more intimate with our midwifery staffing and the cleaners and the patients, because we had to work in such a confined environment.
Dr. Fatiaki, in terms of what Amanda was saying, you know, there were some very significant events in your families that you missed. You know, there was the homesickness, you know, the mums missed the Mother's Day. There was, you know, there was anniversaries and birthdays. You know, I'm just wondering how you guys are coping with with all that as well. I mean, yes, there is, you know, your response, and I must congratulate you guys. You did extremely well. And like Amanda was just saying, you know, the highs, you know, around you were able to form bubbles very quickly. You came in teams, you know, leaders developed, communication got better, the community support came on board. They just came in together, they supported you guys. You know, Zoom became, you know, the norm, you know, the communication. There was also, but on top of all that, you still had your CME going, your continual medical education, you know, updating yourself with the latest, etc., etc. I mean, that's just phenomenal. There's a lot of self-reflection, and also there were things that came back, like Amanda was saying, around, you know, hand hygiene, and then all the new lessons around decentralizing all these services, you know. I know, I mean, I probably covered too much, but I was just really interested, you know, in terms of your families, you know, and how it impacted you, you know, in terms of mental health, and how you guys cope with it while you're in there.
One of the things I think really helped the group was we had some divine intervention, I guess. And if the time permitted and we didn't have an emergency, we'd have daily prayers at 6 a.m. and 6 p.m. And that was with the whole group. We'd sing praises. And I think that really grounded most of us and encouraged us and motivated us to actually push on. And there were individual, I guess, groups that were sort of the comforters, who were quite sensitive to people's ups and downs during the lockdown. And I'm very grateful to many of the midwives that were with us at VCSA.
Thank you, Dr. Fatiaki. And there's quite, I realize there's quite a few. Amanda, have you got your chat up? You're probably seeing what's being said. I'm not sure whether Dr. Vasatia is still with us. You know, just awesome presentation. There's a question here. You mentioned that patients had to be COVID-free to enter premises. How long is the turnover for the COVID PCR tests?
So currently at Lautoka Hospital, during the lockdown period, it took quite a while because we had to transport the test from the site to the lab, and that would take around 2 to 3 hours. And currently at Lautoka Hospital, it takes about a little over an hour, less than 2 hours, to get a result.
Okay, I hope that answers that question. So is it getting better now, or is it still the same?
Definitely, I think it's getting better, because we're learning every day, and processes are getting reevaluated, and each day, through, I guess, the handovers and the discussions, managers are able to change the protocols. So it is getting better.
Great. So there's been some great, people are very grateful, Amanda. I'm sure you're seeing that about, they're very grateful for the talk. And people just, you're saying about the sacrifice of frontline workers, and they're also saying stay safe, everyone. Oh, it looks like Dr. Pugh has answered some of the questions. Amazing work, incredible planning, commitment by your clinical team. one of the biggest fears for us is the services in outer islands of Samoa. And this is from, so I'm not quite sure who this one is from. Especially the island of Savaii, would like to ask what plans were made for outer islands in terms of obstetric care, and were there strategic plans made for transport of cases to main hospitals, etc.?
I'm glad I've got the panel on board, because Dr. Vasitia, Dr. Fatiaki, and Dr. Pio, I think, are the ones that can explain these technical transfer bits.
Okay, I'll answer that. So during the this period, the COVID period, unfortunately, fortunately for Lautoka, we don't have as much islands as Savaii, but we did have some transfers. The transfers were via the helicopter, and those close by islands, we managed to get them through outboard fibers. The only sad thing was when these cases came across, we only allowed the medical cases to come through and no relatives. Unless if it was a pediatrics case, only then they would come. So that's what happened during COVID period in terms of transfers from the outer islands. Hope that answers your question.
Thank you, Dr. Vasitia. So one of the sorry, was this from you, Dr. Vasitia? Lautoka only runs gene expert test runs for 45 minutes. PT PCR is only processed in Suva. Did you want to elaborate on that a bit more, or?
A gene expert is done in Lautoka. We had been doing this since February. Given the fact that when the first wave started, and only Lautoka was the COVID hospital, because the only cases that were coming in were from overseas. And if they were positive in the quarantine facilities, we were accepting all the cases into Lautoka. And we did our planning. We planned ahead, but unfortunately, those higher up, we did not listen. In that, I meant we had asked for more gene expert machines. It was not only until we were in lockdown, the 21 days lockdown, and miraculously we were given 4 further machines. So initially we could process less than 100 in 24 hours, but with the additional 4, now we are processing around 330 in a 24-hour period. But for RT-PCR, we send the samples to Suva.
Great. Dr. Fatiaki, did you have anything to add, or Dr. Amanda? No? Okay.
There was a question in the Q&A, Kara, asking about whether we vaccinated pregnant patients.
Okay, I'll leave that one to you, Amanda.
Yep. Dr. Vasi or Dr. Byron or Dr. Pio, do you want to answer that?
So for the vaccination, all the frontliners were encouraged to get vaccinated. As for AstraZeneca, one of the greatest fear was the thromboembolic event associated with it. When healthcare workers come to me, I just give them the stats. But unfortunately, for the non-healthcare workers, pregnant women, the directive came from the top that it was up to them, and they were advised not to be vaccinated, unfortunately. So most of our mothers are non-vaccinated. Hope that answers the question.
Right.
I suppose if we had a choice, we would like everybody vaccinated, just because the evidence isn't strong. And I think Ranskog has put out a statement about vaccines in pregnancy and breastfeeding. So I'm not sure if it was an economic decision, but I think if we had the choice, we would advocate for it.
Yeah. So that statement from Ranskog has just come through just in the last few days, that has strongly recommended that if all Pacific women at any stage of pregnancy, is recommended to be vaccinated. And the reason being is that if they, although there's a low rate of them being or having symptoms, but if they do get COVID, they're more at higher risk of dying from COVID, or at risk of preterm births, or iatrogenic or preterm births. And yeah, and so that's just, they're strongly recommended now. And I think it just came through quite recently as well from, international studies, and that's strongly recommended now. Yeah.
Thank you.
Sorry,
Dr.
I was
Kara, go ahead, Dr. Vasi.
Sorry, I was part of the vaccination team for the West. So I did encourage all women to be vaccinated. So when we started our campaign, we started with the healthcare workers first. And most of our healthcare workers, even though pregnant, they did get the AstraZeneca. But when they were roll out to the second phase, there was a statement that was made from the top, from the vaccination coordinator from the Ministry of Health, discouraging women who are pregnant to be vaccinated. Unfortunately, the ONG-CSN was not consulted on this. So most of our women who are coming in now who are pregnant are not vaccinated.
So, Dr. Vasitia, in terms of getting your, because I see that James Fong is also, he used to be in ONG, is now in that space. Do you think that you guys should be encouraging him to have some discussions with Ranskog around the evidence? And so how can, in other words, if there are people, in New Zealand and Australia, how can they support your leaders at a decision-making level in terms of the evidence that's now coming out, and encouraging your pregnant women to be vaccinated?
I guess if they had consulted us, the ONG-CSN, we would have recommended that all women to be vaccinated. Unfortunately, that did not happen. That decision was already made. It was already on the comms. They had already announced it, and they had put it in the Ministry of Health information section. So that was the story behind the vaccination with on our pregnant mothers.
I'm just wondering if, given our success in terms of teamwork and leadership, it may not be a bad idea for the ONG-CSN to have a bit more of a stronger stance, especially now that Ranskog have put out an evidence-based paper, and we could use that to advise. I think when the decision came down from the top, it was prior to that Ranskog paper, and now we actually have some evidence that we may actually be able to use, and the ONG-CSN have got a firmer footing, I think, to request that this decision be reconsidered, particularly with the rise in cases. These are patients that are going to go back to their homes, and we have had a couple of positive cases in the postnatal wards. So I think it does give us a platform to reopen that discussion.
Yeah, that's great. Yeah, thank you for that. And yes, it's evidence that you're right. It's come in very recently, and I think it's going to be the same thing for us in New Zealand as well, encouraging our pregnant women to be vaccinated as well. There's another question, Amanda, on the Q&A. How is the uptake of COVID vaccine amongst your staff?
I think I'll leave the head of department to answer that question.
When we had our first dose, the most of the midwives did not agree to be vaccinated. It was not until after so our coverage rate in the hospital was around 46%. And just at the meeting today, it has gone up to 86%. Maybe this outbreak, the second wave, did us justice.
Can I ask why the midwives were very reluctant to be vaccinated?
I guess it's because of most of social media posting about 666, about the chip, microchip, and it mostly because of their beliefs, spiritual beings.
Yeah, I suspect that was very similar to what Glenn Moeller in the first webinar that we did as well, and they had issues similar to PNG. But you know, as health professionals, we also believe in God, and we do pray that, you know, that the right thing will be done for our people. Yeah.
If I may add on, Kara, so there is quite a significant not movement, but there's quite a bit about the fear of getting vaccinated and the various theories that go with it. And the Fiji National University with the research unit actually held a webinar on Monday, and they invited local as well as expat renowned people to help explain the vaccines. And I think this was brought, the initiative was to try and assist dispel the fears, the myths, because a question about the magnet was also asked, and that was demonstrated quite nicely in the webinar. But so there is movement, I guess, you know, by the universities as well to try and allay the fears and the myths, because I think it is a fear that people have. If they don't understand what the drug is, they're not going to use it, and that's human nature, I'd like to think. And if we can educate and allay that fear, then there's possibly a better chance of uptake.
Yeah. Thank you, Amanda. Yeah, hopefully. Just going back to the pregnant mum as well. There's someone who's asking a question on the chat, says, what if the pregnant mother wants to be vaccinated? Can they have that choice? Of course they have that choice.
Dr. Vasi or Dr. Pio, Dr. Byron?
And there's also another question about, and there's also a question about postpartum for COVID vaccination. So any mum, antenatally or postpartum, they should be vaccinated.
Yes, so if a woman comes, I mean, a pregnant mother wishes to be vaccinated, we will vaccinate them, and we do encourage vaccination in the postpartum period as well. But then again, it will needs to fall into during the time when we are doing our campaigns. And fortunately, at this period of, at this moment, we are doing a mass vaccination for Fiji. We have the West vaccination team. We've currently, our latest stats, we've vaccinated at least 1,009 as of today. So
Yeah.
sorry, 109,000.
Yeah, there's quite a lot of things coming through the chat. I'm trying to figure out.
There's one about the bubbles. We're quite proud of our bubbles. There's mention of bubble groups, and it proved to preserve your team's strength and safety in some ways. Could you explain a bit more about this and what it is? I'll leave that to the team, to the panel. Explain our bubbles.
Yeah, I can answer that. early on when we had our second wave start, ONG started putting our teams into bubbles of consultants, registrars, senior registrars, junior registrars, and interns. And we managed to make 3. So we would rotate 1 day on, 2 days off, 1 day on, 2 days off. Whereas the other departments hadn't had a plan like that. And so what had happened was, because we had those bubbles in place, we weren't affected by the lockdown like the other departments were. They then subsequently got exposed and became primary contacts and then had to be quarantined. Whereas our department had one bubble that was working, and that was divided into a day shift and a night shift. So only the day shift got affected and was locked in. And the other 2 bubbles, which were out on their day offs, will manage to provide the services when the lockdown happened. And that's, I think, what Dr. Amanda had alluded to in her presentation, was that unlike our fellow colleagues and the services that the Lautoka Hospital usually provides through physicians and surgeons, we were able to help the Western Division in the different subdivisions with our teams provide the obstetrics and gynecology support, whereas the other subdivisions where they had set up satellite teams, they had to pull from the other tertiary hospital. And then currently what we're doing is with the rotations, we try to keep the bubbles separate. So like, for example, you'd have 1 week, now it's a 1 week on and 1 week off. So you'll have one team that only goes to the hospital, one team that only goes to the clinic, because the clinic has been decentralized to another facility. So they'll only do clinics, that team will only do clinics, and the hospital team will only do admissions, deliveries, operative deliveries. So in the hope that to help, I guess, with the difficulty of having sparse staffing, we wouldn't want to further cripple the staffing if the unit was exposed to a positive case. So currently, what's happened in Nandi, we're in quarantine at the moment, 92 staff are in quarantine because of positive cases, and Nandi Hospital has subsequently needed to be locked down, just like Lautoka has. So even though my team and I are in quarantine, because of the bubbles, the other teams are able to continue to provide the service.
So even with the teams that remain in quarantine, they still join us on a daily basis, and they continue to provide clinical support via, I guess, telehealth.
Yeah, that's amazing, Amanda, because that's how, when we were doing our planning in New Zealand, it was exactly the same. You know, we were put in teams of bubbles of doctors and knowing exactly who's going to be on, who's going to be off, and the teams were not allowed to mix. And like you said, you know, Zoom savvy is that, you know, the handovers are over Zoom, so that there's no contact between the teams, which I think is great. Yeah, you guys have done exquisitely well. Just one of the questions that have come through is that if a staff hasn't been vaccinated, are they still allowed to work in a COVID area?
So for us, all those who come in the COVID active duties, they need to be vaccinated. So if you're not vaccinated, we try and put you in a low risk area, meaning you may need to be shifted to the subdivision. That was the initial plan. But with this second wave, we are all relying on PPE and the many prayers.
Mm.
it's quite difficult because it hasn't been mandated yet. So I guess that allows the freedom of choice, and that's something that we were aware of, like with workers that weren't vaccinated. You'd have that in the back of your mind, but it's quite difficult, I guess, with not being vaccinated, and then if that's compounded by a shortage of PPEs, it can get difficult to manage when you're trying to motivate and encourage people to work in a hazardous environment.
Yeah, that's very true. But I suppose, you know, just like New Zealand, you can't mandate it. You know, people have to have a choice, and people have reasons for. But you know, in the end, I think a lot of people do come around, and and I think one of the key things that people would like to do is that they would like to protect themselves, protect their families, you know, the elderly and their whānau as well, which is something very, very important. Yeah, I think there's a few other comments here. Good evening, and this is from Margaret Tarere. Saying, you know, amazing teamwork in Fiji. Thank you for sharing your experiences during this crisis. Although we're still COVID-free at the moment, but I think this webinar is timely for us in preparation for any cases in the near future. Winaka Vakalevu Team Fiji. Yeah, and there was also a comment from Fiona Dow, that one of our GP specialists in New Zealand, Nikki Turner, gave a very good talk on explaining the COVID vaccine, how it was produced and fears around it. So Fiona, feel free to you know, contact us and just maybe you want to share your slides or yeah, or for us to contact Nikki, because sometimes, you know, visuals are very, very good in explaining about the COVID vaccines and, you know, other ways that might help people to understand it a bit better. Oh, so yeah, I think we've covered everything. Is that all right? Correct, Amanda?
I haven't been able to keep up. There's a few more in the chat in the Q&A.
Oh, it's there. Oh, sorry. There was a question from Sai around vaccination for pregnant women. So what was the cause? Oh, I think you already answered that. And how do we advocate for change? This is someone anonymous. Oops, where is it? Interested in difficulties associated with rapid decentralization of services and the potential impact on provision of services and patient outcomes. But I think you've covered that already, haven't you? I think we're speaking from ONG. I mean, you guys around ONG and how you've got yourself together and ahead of everyone else. And Donald Wilson, what's the stance of the department for staff who decline or refuse to be vaccinated? Would you know if there is any form of victimization felt by the staff? Dr. Fatiaki, I think, did the staff feel victimized?
For Dr. Vasitia. What I do recall is for the staff that hadn't or opted not to have the vaccination, I guess they had an interview. They were interviewed individually, is what I've been told, but I'm not too sure whether or not corridor whispers counts with regards to this. I guess a lot of people had their small discussions in the corridors, and I didn't take part in any of them. So I'm not aware of anyone being victimized.
Okay. This is a question. I think we may have already discussed it. Given that Ranscott has given its position statement encouraging vaccination, my humble question is, an opt-in vaccination service be offered at all levels of antenatal, postnatal, and gynae care for all eligible patients? Is that possible?
I think the idea is a good idea in principle. Obviously, we would need to get our administration on board, but it makes sense. If the call is to vaccinate everybody, then that makes sense that they would be included as well. But it's a decision that would come from higher up. And I guess as we had mentioned earlier, the ONG CSN have now got some solid grounds to make an argument to say, yes, we need to be vaccinating the ONG cohort of patients.
There was one question here about laboratory. Please, what is the turnaround for lab working out of the outreach clinics when Lautoka was on lockdown? Any issues with PPE and other medical supply shortage? Keep up the excellent work.
Byron or Nina?
Sorry, I haven't been able to answer many questions, but I can say that from VCC, so lab work, all our bloods had to be taken to Lautoka Hospital or Nandi Hospital. So that takes about roughly 20 to 30 minutes, and you might get a result back in 1 to 2 hours. But what we did was we didn't send it if we didn't need it. And most of the time we just went clinically. So we had very little blood work to do. And if a patient really needed that much of urgent blood work, then they would need to be referred to the main referral hospital, which was Nandi. But otherwise, all the other deliveries and every other case that we handled, we didn't do much blood work for them because we didn't have the time or the space to do it, unfortunately. So it was very clinical with our patients. If that, I hope that answers the question.
Oh, thank you, Dr. Peel. I think, well, we're coming to the end of our time, and Amanda and Dr. Patiaki and your team, unless you got anything else you'd like to add, I would like to say thank you so much. I mean, that was very, very informative for us. Lots of lessons learned. There were lows and highs. Yeah, that's just really amazing. If not, then I might ask Dr. Fatiaki to end us with a word of prayer, if there's anything else. Dr. Fatiaki, are you still there?
Yes.
Yeah, I'd like to say thank you to everybody who's managed to join in tonight. We really appreciate it, and thank you so much again to you guys for joining in. And Dr. Fatiaki, I'm just going to ask you to end with a word of prayer now, and just bless you all in Fiji for all the work that you're doing. Congratulations and well done. And yeah, look forward to things getting better from here on for Fiji. Thank you, Dr. Fatiaki.
Thank you, Kara, for having us.
Thank you for having us. Okay, let us bow our heads in prayer. Father God, we'd like to thank you for the blessings and the opportunity to present. We thank you for the presenters, the panelists, and all the attendees. We give thanks for those who care for the sick at this difficult time. For diligent family practitioners and experienced specialists, we thank you for careful nursing staff. We thank you for cheerful housekeeping workers. We thank you for attentive care aides. We thank you for skilled sonographers and lab technicians. We thank you for admission administrators and support staff. We thank you, Holy One. We know that in hospitals and care homes, in emergency rooms and intensive care units, the work of healing is dangerous and challenging. And we thank you for those willing to serve. We acknowledge the sacrifice and continual pressure that is the lot of those who care, and we thank you for work they do for us and for the communities to which we belong. Oh Lord, may your love sustain them, your peace surround them, and your Holy Spirit inspire them through the most challenging times. Amen.
Thank you very much, Dr. Fatiaki. Thank you, Amanda and the team. Thank you, Dr. Pio, Dr. Vasatia, and thank you everybody for joining us tonight. God bless you. Love you all. Thank you.
Thank you. Bye-bye.
Bye.